Talked a couple weeks ago about using the law of reciprocal inhibition to get full extension of an elbow. Let's look at how we're going to use direct inhibition to get full range of motion of a post-op meniscal repair. So post-op meniscal repair comes in stuck there as far as getting into extension. So if I test direct inhibition of hamstring, so here's bicep fem, short head, long head. Here's semitendinosus, membranosus. He fails all those. I treat those. He drops down to about there. What else is going to cross the knee to stop me from getting him into extension? How about gastroc? So we test medial and lateral heads of gastroc. He fails both of those. Treat those. Come back, and now he's got full extension. So this is how we get full extension of this knee, by just working on getting facilitation of the hamstrings and the gastroc. Because remember, if they're stuck because they're inhibited in a short position, they're not going to lengthen to let him go into full extension. So did I come back later and then do quads? So intermedius, lateralis, lateralis, medialis, medialis, and genioarticularis? Yes. And now he can do go ahead and do your straight leg raise. So he can do a full straight leg raise, visit 1, okay? So if you want more information about how we did this, keep watching this video in our Facebook.